For your health, drinking your morning cup of joe can help your heart. It is music to your ears if you're a coffee lover, of course. Dr. David Geier here to break down the results of a new study that contradicts some past studies, and we're so excited about it. Anytime us morning newsers get some good news with coffee and that it doesn't harm us, we're excited.
Yeah, I'm a big coffee fan too, so
Yeah.
I get it. But you're right, that for years and years we've worried that coffee was not only maybe not healthy, but specifically for heart risks. And this study and a couple others over this last year have shown that not only may it not be harmful for our hearts, but it may actually be good for preventing heart issues.
And what did it find? I know it looked at, two specific heart disease risks that it could lower, right?
Yeah, this one was interesting because it looked at what's called, it's a big fancy term, cardiometabolic multimorbidity, a combination of things like coronary heart disease, stroke, type 2 diabetes, and the prevention of that. So none of the people at the beginning of the study had that. They tested, it was like 180,000 people, and monitored not just for coffee, but also green tea and black tea, and found, ironically, or maybe surprisingly, that a moderate intake of coffee, somewhere between 200 and 300 milligrams of coffee, significantly decreased that risk up to 50%, which is much more than we've thought in the past.
That's impressive, and it's a big study. You're talking about 180,000 people, not just 20 people here, 20 people there.
Yeah.
So it's a decent group.
And what's interesting about this study and a number of others that have come out in the past year is they've done a really good job at controlling for other factors. In the past, we thought, well, maybe the coffee drinkers exercise more or eat healthier, but they control for all that now and think that, again, that this is related. It's not cause and effect. None of these nutrition studies can say that it causes this, but it's certainly associated with lower risks of heart disease.
And when people hear this, they say, coffee, okay, I can go drink whatever I want. No, this is specific to not a latte that's loaded up with sugar and all of that jazz. We're talking like your cup of coffee, right?
Absolutely.
Black coffee.
I couldn't agree more. I call it coffee flavored sugar bombs. If your drink has more than 200 calories, you're drinking a milkshake, not coffee. Yes, what we're talking about is black coffee. I mean, you could add non-sweetened or non-sugared sweeteners or things like that, or green teas or black teas. What's interesting is we don't really know, is it the caffeine in it or is it something else, the polyphenols? Because some studies, not this one, have looked at even decaf coffee having some benefits. So we're not exactly sure what it is. And also, this is not a license to start drinking tons of coffee, but if you do drink coffee, you don't need to cut back for heart fears.
Yeah, I will say that's one thing I pat my back on. I love black coffee. Just I like the taste, the bitterness. I know people think we're crazy, but hey, it's good, right? And at least some good news here. So what do you like, a cup, 2 cups a day?
I generally say somewhere around 2 cups. This study went as high as 3 cups having benefits. I've seen as high as 5. I think that's quite a bit for other reasons, jitteriness and everything else. What I'd also stress is we don't know if this applies to carbonated beverages like soft drinks or energy drinks with much higher amounts of caffeine and some other substances. Right now, at least if you're saying, all right, I'm going to drink it for heart benefits, stick to black coffee, green tea, or black tea.
All right, good news for us coffee lovers. Dr. David Geier, thanks so much for joining us.